So the most important to me is to make a condition looks very simple, or rather to simplify. What is anemia? Anemia is a blood disorder. We know it is a disorder of the blood, okay, in which there is reduced hemoglobin levels, okay, which might be, due to excessive destructions of the RBCs, okay, which is red blood cells, okay, inadequate production of red blood cells, or loss of blood. Okay, those three things. One, there might be inadequate, okay, supply, or rather production of red blood cells, or because somebody is losing blood, a lot of blood, okay, or there is a rapid destruction of the red cells. Now, I'll give an example of each. When I say rapid destruction of red cells, the example I'm going to give is in cases of malaria, okay? Remember, malaria, they do attack the red cells. So once they attack the red cells, the body itself, it is going to bring about a certain mechanism to break down the cells that have been affected by the spleen. So as the blood passes through the spleen, this red cell will be broken down in pieces, okay? So if there is a rapid breakdown of those red cells, meaning somebody is going to have only a few hemoglobin levels, because hemoglobin, harbors in a red cell. That's why a mature red cell does not have a nucleus, because that place has been replaced by the hemoglobin. Now, since I'm making things very simple for you, I'll give examples in almost all the three that I've mentioned. I've already given an example in rapid destruction of red cells in cases of malaria, or in cases of sickle cell anemia, okay, where there is also rapid destruction of the red cells. Another cause is, blood loss, when you are losing a lot of blood, okay, maybe in cases of bleeding, when somebody is bleeding a lot, meaning that you lose a lot of blood, then later, you can have, what we call anemia. Another example, under less production of red cells. Sometimes, there are so many conditions that can result in this production of the red cells. Maybe kidney diseases. Okay, kidney plays a very vital role in releasing very important hormones that triggers the production of the blood cells. Okay, so now and then also maybe malfunction of, or rather disease of the bone marrow. Okay, disease of the bone marrow. So if there is a disease, meaning that the production of the red cells will be very slow. Okay, now that is about anemia. So now what I want is to also simplify. Okay, I want to also simplify for you on the classifications. So classifications of anemia, actually, you can classify anemia in so many ways, but for today, I'll just classify anemia into two ways. One, I'm going to classify anemia according to the cause. Then I'm also going to classify anemia according to the appearance of the RBCs. Okay, now, in this case, what am I saying? When we classify anemia according to the cause, these are the following classifications, okay, or rather the types. These are the following types under this class. Okay, now in this case we have hemorrhagic anemia. Okay, we have hemorrhagic anemia. Now what is this? So in this case, hemorrhagic anemia is due to the blood loss. Okay, it's coming from the word hemorrhage. Hemorrhage, it means bleeding. So when we say bleeding, as I said, it can cause anemia because somebody's bleeding. So hemorrhagic anemia is due to blood loss. Then the other type is hemolytic anemia. Hemolytic anemia, this is the anemia which is due to excessive destruction of the red blood cells, hemolytic anemia. Under this, I mentioned that I gave an example where there is rapid destruction of the red blood cells. One of them is malaria that can cause anemia. Okay, so there is hemolysis of the red cells there in malaria, and then also sickle cell disease. It also falls under hemolytic anemia, where there is rapid destruction of the RBCs. Then we in this same one, rhesus factor incompatibility can also cause hemolysis of the red cells, and so many other things that can cause this type of anemia. Then we also have another type, which is aplastic anemia. So aplastic anemia is the anemia which is due to bone marrow bone marrow dysfunction, or aplastic of the bone marrow. So I gave an example also to say anemia can be caused due to slow production, or rather low production, okay, or inadequate production of the red cells. And if the cause is coming from the bone marrow, now in this case we are going to say it is an aplastic anemia. Hope you are understanding and actually following. It is very imperative to just like and share so that others also can benefit. When you like the video, in case you are interested, you can still come back and watch, okay, because it will be popping up on your screen when you like the video and share. Okay, now we have the other type of anemia. With this type of anemia is actually called blood forming element deficiency anemia. Blood forming element deficiency anemia. Now, what is this type of anemia, and why am I saying blood forming deficiency? There are some of the elements that are very important into our bodies because they help in the formation of blood. So I say blood forming because they form blood. But those elements that help in the formation of blood are not there. If those elements are not there, what happens next? What will happen next is that there might be slow, or rather inadequate production, inadequate production of the red cells, because the elements that helps in the formation of blood are not enough, so this type of anemia, because there is less elements that forms the blood, we are going to say blood forming element deficiency anemia. So now we have iron deficiency anemia, folic deficiency anemia, vitamin B12 deficiency anemia. All those, they fall under blood forming element deficiency anemia. Now if there is no folic, meaning that if there is a shortage for folic, meaning that we are going to say folic acid deficiency anemia. Now in this case, what you really need to understand is that we also have the other classification. I said this is the classification according to the cause. Now I'm going to explain on the classifications according to the appearance, how the blood cell is appearing is what will determine the type of anemia this person has. So now in this case, we have what we call macrocytic hyperchromic anemia. Okay, so now in this type of anemia, the cell appears to be larger than normal. Okay, and appears, red, usually seen in folic acid or vitamin B12 deficiency anemia. Now, there is also another type which is microcytic hypochromic anemia. So in this one, the cell appear smaller than normal and they appear very pale, and usually due to iron deficiency in this case. Then we also have another type which is the normocytic, normochromic anemia. So in this one, the cells appears very normal, the cells appear very normal in size and also in color. Mostly this one is seen in acute blood loss, acute blood loss, when you have lost a lot of blood, the example is hemorrhagic, where you have acute blood loss, maybe due to RTAs and so on and so forth, fights, or maybe PPH and so on and so forth, So now in this case, we are now going to talk about what we need to talk about. We'll talk about predisposing factors. Now, like the video, share and follow so that you come back for the next video, because we are going to talk about predisposing factors. Then we'll talk about pathophysiology, we'll talk about signs and symptoms, we'll talk about complications, then we'll talk about the management, where we are going to talk about the medical management and then also the nursing management. We'll talk about all those things. So don't worry, we are going to make sure that we talk about these things. Follow for next video.